Irit Felsen is a clinical psychologist licensed to practice in the state of New Jersey. Dr. Felsen has been in practice for more than 25 years with a private practice located in Mountain Lakes. Is that still true?
Yes, and in Englewood.
And in Englewood. While focusing on her private practice, Dr. Felsen has remained very active in research. She's a member of the Trauma Research Group of Yale University. She also has a research affiliation with the Swiss Center for Neuroaffective Sciences at the University of Geneva, Switzerland. Dr. Felsen is on the faculty at OHEL Institute for Professional Training in Brooklyn, is a clinical specialist and coordinator of Holocaust services at Jewish Family Services of Metro West in New Jersey.
Was.
I have to update this, I see. And an emergency psychiatric services and state-certified mental health screener. Dr. Felsen's predoctoral and postdoctoral training was at the Yale Psychiatric Institute. She has a PhD in psychology from Hamburg University and trained in advanced group therapy at the Military Academy in Jerusalem. Her master's is in clinical psychology is from the Hebrew University of Jerusalem, and she received her honors BA in psychology from Haifa University. Dr. Felsen regularly presents in professional conferences and training workshops for mental health professionals, students, teachers, schools, and community organizations in the United States, Canada, Israel, and Europe. As a psychologist and researcher, she feels very strongly that it is important to educate the public about trauma and related issues. An important perspective that grew from her work with previously traumatized people is how to promote resilience and adaptive coping skills. As an Israeli and a daughter of Holocaust survivors, and as proven by research, she believes in the healing power of relationships to sustain people through hardship and crises and help them regain their lives and their joy. It is my pleasure to welcome Dr. Felsen to speak with us today about survival and PTSD and creative aging.
Thank you. Oh my God. Thank you. Thank you very, very much. That was amazing. That was really beautiful. I have to have it framed. Okay, so, one of the things that I wanted to speak with you today about is indeed the combination of resilience and post-traumatic reactions in survivors of trauma, in child survivors of the Holocaust as you age. And I think it's a very, very important topic to speak about, both aspects of it. As Elizabeth said, it's very important for me to highlight the resilience aspects of it and to help people focus on what there is and what they have and what they've accomplished and how to make the most of this chapter in life, as every chapter in life. And also to understand, to help understand and to help speak about some of the ongoing or sometimes recurring post-traumatic symptoms that come back as you grow older. You know, I had a patient who once very bitterly, a Holocaust survivor, who once very bitterly said to me as a representative of the mental health profession, "Where were you before?" And it's a very, very poignant question. Where was the mental health profession before, when the child survivors needed it, perhaps, when the survivors needed it very much after returning? And the profession was not ready to help. The profession was not ready to encounter the very real impact of such disaster, of such catastrophe on individuals. We were still, as a profession, kind of hung up on concepts of, that people past a certain age don't really get affected by what happens to them. Only up to a certain age does it really change the personality. And, my answer to my patient that time was, when she said, "Where were you?" I said, "I was growing up." I was growing up. And it really did take us, there were some of you, like, what's your name? Greta. Some of you, and like my very good friend, Professor Dasberg in Israel, who happens to be one of the leading figures in a psychiatrist in the treatment of child survivors. He's a child survivor himself. He happens to be the father of my kindergarten friend. So I'm friend with the father, I'm friend with my kindergarten friend Ori. Some of you were lucky and managed to go to school and get a career, and some of you went into the healing professions and were very effective in helping their fellow survivors. Studies do show that therapists who are survivors themselves and therapists who are of the second generation have a better outcome when working with survivors of the Holocaust. So for the second generation, it took us a good 30 years to get there. So now we're here, and it is my honor and pleasure to speak with you and to try and speak about something that is actually not very well discussed, and that is, like I said, post-traumatic reactions in the elderly. We hear a lot about post-traumatic reactions these days, much more than ever in the past. And I actually wanted to start, before I go into it, let me show you something quite amazing, which is this. And where were we? Yeah, here, let's see.
Used to be, you know that.
It's a documentary, by the way, sorry.
The idea is to compete, and you don't have to win, but whenever you do win, it's a nice feeling. Winning is everything, Brad. What do you mean? Good guys finish last.
I understand that the fellow that I'm playing today is only 94 years old, so plays a youngster again.
There's a difference between their team and our team. We play a finesse game, and they play let's say, a muscle game.
Just courage and faith and strength. That's where the inspiration comes from.
So this is a documentary about some people who managed to do even that as they're in their, above 85 years. And I just wanted to show you this in the beginning to set the tone as to the focus now, which is really on ability and on continuing to do whatever one can and on continuing to enjoy what you enjoy, and that kind of a focus is a very big shift from the way old age or the later years were looked at until recently. Until recently, everybody above 65 was looked at as what's missing, what is their sickness, what is their condition, what is their disability, what is the deficit. And now we're really talking from a different place, or at least a lot of us are focusing on a different perspective, the perspective of resilience, the perspective of ability, the perspective of what is still and what is actually even gained by old age, not only what is lost. Certainly we lose some things. I can tell you I've been losing a few things myself as time goes on, but we also gain a lot of things. Let me ask you, for example, a simple question. When do you think you've made the best decisions in life? When you were in your 20s, when you were in your 40s, 50s, or later on? Who made their best decisions in life in their 20s? Okay, that's kind of like it. Who made their best decisions in life between 40 and 50? Who made their best decisions in life later? That's it. That's it. That's a very typical reflection of the situation. And it really speaks to something that we gain with age. We gain experience, we gain perspective, we gain wisdom, we gain an understanding of ourselves, we gain a lot of things that we can still capitalize on for many, many years past the years when our physical health is perhaps not at its best and our prowess is not at its best in certain ways. I am completely kind of throwing my notes into a mess and speaking to you sort of spontaneously. How much time do we have?
1 hour total, so
1 hour total, and we would like to have some discussion. So let's say 40 minutes probably. Okay. So, as you know, aging is a progressive process. It really is something that starts from the moment we are born, and we look at it for the most part for many years as a very positive thing. Like if you speak to my 18-year-old or my 15-year-old, if they look older, it's a great compliment. And if they can do something that they couldn't do before, then it's wow. It's only at a certain point in life that we begin to look at it as a negative thing. And, you know, it's understandable. We lose at some point all kinds of things that were very important to us. You know, this week I saw my patient Neil, who is about 74. He looks good. He looks young for his age. But he was diagnosed with Parkinson's recently. And he falls a lot, and he can't play ball with his grandchildren. And he sat there, and he was totally depressed and tearful and saying, you know, who am I now? Who am I now? I'm not the man I used to be. How could that happen to me? And his wife, who's a very resilient woman, is sitting there and saying, but you know, and he goes, I can't play ball with my kids, with my grandchildren. I can't do this. And she says, yeah, but you know, you can sit at the table and play a board game with them. You can talk with them. And there you have the different perspective in terms of a focus on what you can't do or a focus of what you can do. You know, some of you who like Matisse's work, Henri Matisse, may know that Henri Matisse painted these huge murals when he was well. But when he got very old and he couldn't stand up and paint the big murals, he developed an entirely new art form. He created these paper cuts. You know, his helper would give him a piece of paper and he would make these paper cuts. And from the paper cuts, these new images were created that were really a new art form. It's really about adapting, or as my mother used to say, in life you have to bend like a grass with the wind. You can't be a tree that stands like this, because when the wind comes, it'll break you. You have to bend with the wind. And that, I think, is a very good image to the concept of adaptation. So each of us really ages at a different rate. Let me talk a little bit about aging, and then a little bit about post-traumatic reactions and about resilience. We age at a different rate. It's really like, as a colleague of mine put it, it's like building a house. From the moment the house is made, it begins to suffer wear and tear. And how well it will endure that wear and tear depends on two things, right? The materials from which it was made, and that is essentially our DNA, or in other words, one should choose one's parents carefully. Because if you choose them well and they have good DNA, well then you're in good shape. The other thing is environment and the impact of environment. That has to do with our lifestyle, you know, what we eat, what challenges we're faced with, what teratogens, you know, that is all kinds of toxins from the environment we're faced with, stress, all of those things which really impinge upon our cells and our molecules and create damage. As we age, we're less able to fix that damage, and for that reason, we kind of look older and we grow older. Trauma is absolutely, trauma in earlier years, trauma in prior years during the lifespan is absolutely a risk factor for various aspects of aging. And I would like to speak a little bit about that because it's little spoken about, as I said, and so you get a lot of people who all of a sudden, when they're older, after decades of very good functioning, begin to have all kinds of symptoms which they themselves don't really connect with what happened to them when they were sometimes 5 years old, certainly at other times during the lifetime. And sometimes people feel that it's a weakness to all of a sudden indulge and feel bad about things that happened such a long time ago. In addition, post-traumatic reactions in the older years don't present like in the younger years. In the younger years, there is often the very dramatic symptoms of re-experiencing and intrusive memories and flashbacks like we see in the movies like Born on the 4th of July. Did you see it? Right? The PTSD picture like that is a typical picture for relatively fresh PTSD. But what studies show us is that these things, for the most part, for most of you, these flashbacks and the intrusive memories subside with age. Not that they're not there, but they subside. And what is left is the much less dramatic symptoms that include a generalized level of hyperarousal, sort of a responsiveness to a reactivity to things that other people don't react to as danger signs. I bet you if I all of a sudden made a very loud noise here, everybody here, regardless of how agile you are, would jump. I'm sure all of you have a pretty distinct startle response, yes? The response to a loud voice. And other things that you respond to more than you should, as if it is a bigger deal than it is, and it creates issues in relationships, and it creates a sense of you being perhaps less calm, less pleasant to be with at times than other people. And for you, of course, it might create a certain sense of anxiety and disquiet that you don't necessarily understand. The other thing that is very problematic, which remains for some people, is a certain numbness on a certain level, a certain emotional numbness, a certain emotional detachment. It may seem paradoxical. On one hand, you're very hyper-aroused in a way, and on the other hand, certain situations where a certain emotional reaction is expected don't get responded to in a way that other people might expect from you. So when we look at children of survivors and children of child survivors, they speak about the fact that sometimes their parents don't seem to respond emotionally the way they would have needed them to respond. They're not perceived as quite emotionally as available as the child would have liked them to be. This is important to talk about because especially child survivors, PTSD in the elderly, as I said, is not very well recognized by professionals. So when older people of all kinds, whether it's Vietnam vets, at least everybody knows it's a Vietnam vet. But if somebody with some kind of an other trauma that is less publicized comes to a physician and says, I don't sleep well, I have this ache and this hurts me and that hurts me, and I have some difficulties with some respiratory condition, all kinds of things that we know are at a higher risk for people who have gone through trauma. Many medical conditions, many somatic conditions are the expression of trauma in prior years for older people. But when the physician hears this, they don't necessarily think about a trauma. And if there is no physiological reason, sometimes there is, and sometimes there isn't, and then there is a sense of what's going on with this person. This is really something I can't really help, and people are not getting the help that they could use because help is available, and it can make a very big difference in the way the older individual feels. It's not something that one needs to live with. And this is why it's important that we talk about it. That if somebody has a sense that they're not living as well as they should at this point, that they're not feeling as well, that things are troubling them, that they have pain, that they have aches, that they have issues, the thought that it might actually be related to trauma and that the trauma needs to be addressed is very important. Like I said, it's especially important for child survivors because many child survivors used to think over the years that their story is not so traumatic because they were just children, because they didn't really know what was going on, because they were protected by some adults around them, so they really didn't suffer as much, or they were in hiding. They didn't suffer as much as the people in the concentration camp. And we absolutely know today that that is not the case, that the impact of many things about the experience of the child survivors was very, very profound. So that's, I did say a few things about that. I wanted to show you a picture which I might have shown you before. Let me see, but it is in the beginning, so give me a minute. I might have shown you this picture. I like it very much because it is a very good example of something. What do you see here?
Grapes. Grapes.
Grapes, grapevine. I mean vineyard, right? Is that how you say it? Yes.
Vineyard.
Grapes, vineyard. Exactly. I see concentration camp, Rachel says. This is exactly why I show it to you, because for survivors and for children of survivors, this is a photograph taken by a good friend of mine, child of survivors himself, a professor of physics at the Technion in Haifa, who likes photography very much. And he sent it to me because he knew exactly what I would see here, which is what he saw there. We saw there at first sight, at first glance, a concentration camp and emaciated survivors standing in the snow behind the barbed wire. Many people with Holocaust legacy see that, and then of course we can also see what it really is, which is a vineyard. I can't get the vineyard. I can't get that word for some reason. Vineyard, okay? And why do I show it to you? Because to me this is a very good way of looking at the way that prior trauma plays in our psychology. Your psychology, our psychology as a second generation. We look at something and we see two different realities. We see our internal reality of the Holocaust, and we see the external reality of what it actually is in the present, in the here and now. And if we can, in a way, distort, if you like, a very concrete stimulus, like a photograph of a vineyard, then think about how we also bring these two realities to bear on situations in life, interpersonal situations, interpersonal interactions, all kinds of things like that. So, like I said, give me a time by which I have to stop, Elizabeth?
Well, we should finish completely in about a half hour, so maybe talk another 25
Another
minutes.
25, 20 minutes. Okay. What's that?
Let's speak.
Okay, let me just see what I want to
We
do.
don't have to be so strict.
Okay. So, let me... Okay, so this I call this dual reality, this experience of living in both, in the here and now and in the past. And sometimes the past plays more of a role and is more prominent in the way we respond to something, and sometimes less. And that can be very confusing to all of us with a Holocaust legacy. For example, my patient said to me after September 11th, that's I think a very concrete and blatant example. She said, I came to my father's house. Her father was a very kind man, a very nice man, Holocaust survivor. and they saw again one of the things on TV that we all watched a million times, and he was triggered. And she said, oh my God, how awful, how horrible, all these people that were murdered, that were killed. And he was triggered by it, and he went into a rage and a tirade about, and who was there for us? Yes, this is terrible, 3,000 people, but you know, how many of us were killed a day, and nobody, cared, and nobody was there. And she was horrified. She said, who was this man? This is my father? My father is this compassionate man, this nice man. How can he be so hardened and so unfeeling? And it can be indeed very confusing and very difficult for people living with any kind of a trauma survivor when they respond from that place. Because those moments when people respond from their trauma and yell or scream or say something very, very difficult to hear, those moments remain in our memory much more than all the other times when people are nice and kind and giving and calm. That is very natural. That is not because we are nasty people and we only focus on the negative. It's because our brain, in the process of evolution, became much, much more sensitive to negative things. We have to notice things that are negative. We have to notice signs of danger. We have to notice if there's a rustling in the bush, that means that maybe a tiger is going to jump at us. Because being the way we are, with no claws and with no great teeth, and we don't run that fast as other species, what we have is our very keen perception, our brain, our capacity to immediately perceive danger and respond to it in time. That's what evolution did to our brain, and the way that it means we are today is that when your husband yells at you, you remember that a lot more than all the times in between when he was very calm and nice and kind. That's life. Certainly, that's life for a child of a trauma survivor, because children are much more susceptible even to perceive danger signs from their parents. So let me go over here just so that you know, since for me this is almost like everybody knows what PTSD or what post-traumatic reactions are, but I would like to tell you, because I do want you to be aware of it, and I do want you to be aware that to the extent that one has some of this, if it's troubling to you, there is actually very effective ways to help. So the diagnosis of post-traumatic stress disorder or post-traumatic reactions requires first and foremost establishing a relationship to a traumatic event. It's the only mental condition in the entire, system of our diagnoses that actually relies on an external event having taken place. Something happened in reality, and as a result, people have these symptoms. That is why, like I said, it's a lot of times very problematic for all kinds of physicians and healthcare providers who work with older people to establish the relationship, because if they don't know much about it, and if they don't know much about the Holocaust or about something else, they don't necessarily think, 60 years ago, this is what happened. In fact, it's so hard for people to understand that certain traumatic events can be effective or have an impact on someone 60 and 70 years later, that 2 weeks ago I was giving a workshop to very seasoned professionals. And I was giving them an example of a Polish lady, not Jewish, who survived the Holocaust, who survived the war in Poland. She didn't have a father, the mother had 7 children, she had to survive, she had to make do. It was very difficult. It wasn't like what Jewish children went through in the Holocaust, but it was very difficult. And then, came the communists, and then all kinds of traumas occurred because of that, and then her husband died because he was a total alcoholic, all kinds of traumas. And she's now 82 years old and she has paranoid ideation, and that's why I was called to consult about her case. And I'm telling these mental health professionals all about that, and we're talking about this, and the question comes up, so what was her trauma? You know, this is not someone who wasn't listening to me. This is not someone who didn't get it. But you know, the fact that when she was 5 years old, you know, her father died, and then her mother was alone with 7 children, and had to do this and had to do this, and then there was a war. It's so long ago. Even a theology student, a PhD theology student, asked me in all sincerity, when I talked about Holocaust survivors to a class, said to me, really, after 60 years, it still has an impact? And I said, well, maybe you can make it more individual and more concrete for yourself. Think about it this way. Think about your family being at home and sleeping at night and everything is normal, and some hooligans break into the house and kill them all in the night, and only you are left alive. Do you think it would still have an impact on the rest of your life for 60 years?
Yes.
It's just overwhelming. The concept of the trauma is so overwhelming that people have a hard time with this. So even professionals who see older individuals and are aware of it tend to sort of blur it. So the relationship to the trauma event is hard to establish sometimes. The other clusters that we talk about in post-traumatic symptoms are, like I said to you, hyperarousal, which has to do with the constant state of sort of disquiet, a reactivity to stimuli that doesn't really, is not really necessary, avoidance of things that have to do with the trauma or with topics that you feel are related to the trauma, a certain emotional constriction, because you know, in order to be sitting here, the elegant, successful, accomplished group that I'm looking at, you had to do what my parents had to do. You had to somehow put a shell around these experiences and put it somewhere and move on. And in order to do that, we cannot, the way our brain works in terms of memories and emotional memories in particular, we cannot choose, select and choose. We cannot select to take only the traumatic experiences and put them away. We have to put away a certain greater aspect of our emotional reactivity. Because as soon as we allow ourselves to be emotionally fully open to the world and to experiences, something might remind us of the trauma and trigger us. And hence the emotional certain constriction that I spoke about before. Okay, lastly, I'm trying to see what we can... Okay, we do know, however, that people are unbelievably resilient. And if we needed proof for that, then here you are sitting in front of me. Even as a reaction to very traumatic experiences, in the general population in the United States, only about 10% will respond with post-traumatic reactions to serious traumas such as assault, rape, robbing, car accidents, all kinds of things like that. Interpersonal trauma is more malignant than natural disasters or car accidents. So if someone does something to you intentionally, inflicting suffering upon another person, that has a greater degree of damage than, you know, a disaster or an accident of some other kind. 1/3 of the people who respond with PTSD initially will actually get better even. So even less people will develop long-standing post-traumatic reactions that really are very, very severe. However, 2/3 will go on to experience post-traumatic reactions for the rest of their lives. In war veterans, the numbers are much higher. For example, in the veterans of Vietnam War, the numbers are more like 24%. In the veterans coming back now from Iraq and Afghanistan, the numbers are more around 30%. And in Holocaust survivors, the numbers were higher than 50%. Some people say 90%. Some degree of symptoms, not necessarily the full-blown post-traumatic stress disorder, but some degree of symptoms that remain throughout life. And when the symptoms remain throughout life, they can be quite troubling because somebody, I'll show you a picture in a minute, people can be very highly functioning and yet have pockets of symptoms that are very troubling. For example, a very exaggerated degree of hypervigilance, of mistrust that almost verges on paranoia and can be very troubling to the person themselves or to their families. I'll show you in a minute. What's important to, when do I have to stop, Elizabeth?
20 minutes.
20 minutes, okay. What's important to remember is that for many people, like I said when I started speaking, the symptoms did not exist in an even way throughout life. For many people, the focus on rebuilding life and rebuilding the family and rebuilding their Jewish identity and connecting with a new society, whether it was here or in Israel or in, in South America or wherever it was, the focus was such that symptoms subsided and were sort of quiet. And it's with older age, you okay?
Yep, okay.
It's with older age when the symptoms seem to come up again and resurface due to many very normal processes that have to do with aging. Some of it is that as we pass a certain point in life, which I've passed a little while ago, I think also, we start thinking back. We start reevaluating. We start thinking about our decisions and our choices and sort of reviewing our life. When what we review is very traumatic, well, obviously the process of reviewing and of memory surfacing brings up these traumatic memories as well. We also have more time. That means we have less distraction. All of these things put together make it more likely that traumatic memories resurface. Let me see, I want to decide what we will say some more here. So, now, as we see in studies that look at aging in the United States, aging in the United States is being pushed up and up and up and up, which means people are living longer, people are staying healthier, and people are experiencing the limitations of old age only further and further up into the later and later years. A colleague of mine who does primarily psychogeriatric work in Florida says to me that these days his average patient is 90 years old, and it's not that rare to see people in their 100, in their people who are 100 years old, and this is expected to even grow. As we grow older, our friends and relatives also grow older. That's another one of the issues that are problematic because, as I said before, we don't age at the same rate. Some of us had good DNA, some of us had less good DNA, some of us responded better to the stresses that we encountered, and some of us, their body responded less well to those stressors. And as we lose friends, it's very, very important that we find new friends, that we find other people to connect with. And that is, if you like, our socio-emotional portfolio, shall we say. You know, we have our investment portfolio, we have our portfolio of what sustains us. And what sustains us is, to a large extent, our connection with other people, our connection with activities that mean a lot to us. And that is very, very important to take care of it, at least as much as we take care of our other investments. Let me say that there are a few things that I would like to show you about some of the options that are available that some of the elderly in this country are developing and enjoying, which I find remarkable, inspiring, and want to share with you. One thing is, I call it Act Your Age. It's the utilization of acting as a way of connecting with new people, connecting with new talents that you might have. A friend of mine who's my age went to a psychologist, went to a workshop like that last weekend and said to me she never thought she had any talent, but it was something that was embedded in a workshop for psychologists. So she attended the workshop and happened to stumble upon this opportunity to act out some interpersonal or emotional situation. She discovered a talent she never knew she had. She said it was a fantastic thing for her. And I have to tell you, I've heard that before from several older individuals who had the opportunity to participate in such a thing. There is now Witness Theater, which maybe some of you heard of, where a survivor contributes their story, and a group of young people, high school children, write the dialogues, write the music with help of teachers, and act it out. Self-Help created one like that. In New Jersey, the Holocaust Council created one like that. There are many possibilities of connecting with such a thing, and the impact of it on the children, on the survivor, on the entire community of professionals that worked with this, and on the community that watched it is profound. It's also done in all kinds of other forums, and I can show you just a clip from a 96, I think, year-old lady who actually participated in it in the nursing home. Just one second. I hope that you'll be able to. This is a poor quality video that was taken by iPhone by the friend of the person who conducted this activity in the nursing home, who's Ruth Bieber, and she sent it to me because there was no time to get permission from the director who blah, blah, blah. So, thanks to her, we have this little video.
Oh, I see. So, Molly, do you have family here in Florida? Yes, I'm with her daughter and her husband and children. They'll be visiting, I'm sure. Okay.
Wait, excuse me, let me explain. This is a little skit. The lady is 96 years old. She's playing an older woman who comes to join a nursing home or a assisted living community. And the other person is trying to welcome her and tell her the rules of how we do things here. In a nice way, but nonetheless.
Now, Molly, I see you've got a birthday next month. Oh, yes, 98. 98? My goodness, that's a good age. We'll have to have a big birthday cake for you. That would be nice. That would be nice. Yes.
What?
Chocolate cake.
She can do that too, huh? No, doesn't. It's too hard. Okay, never mind. So what happens in the skit is essentially the lady, both of them are, by the way, residents who are playing in this skit. And the younger one is interviewing Molly, who's actually 96. She's supposedly 98 in this thing. And she says to her, well, I see you're going to have a birthday. And she says, yes, and we're going to make a cake for you. But, some people like chocolate, some people like white. We'll make, a half and half. She says, most people like chocolate. And then she says to her, so, we have breakfast here between 7:30 and 9:30. We slotted you, to have breakfast at the 8:30 slot. She goes, don't take breakfast. don't take breakfast. She says, what do you mean? Breakfast is a very important meal in the day. Don't take breakfast. And then, and this is how it goes. It goes, we take a bath. It's very important for us that the residents get, good care. We take a bath at 3 o'clock in the afternoon. She says, 3 o'clock in the afternoon? No. 3 o'clock in the afternoon? No. 3 o'clock I might be playing cards. I might be playing the piano. I might be visiting with somebody. I certainly am not taking a bath. When would you like to take a bath? She goes, sometime in the evening before I go to sleep. Says, but the staff is not there. She goes, well then, I'll just have to do it by myself. And then there is all kinds of, and then she goes to her, but we have rules here. And she goes, well, by the time someone is, she goes, pills. At such and such a time, people come and give you the pills. And she goes, pills? Don't take pills. Says, you don't take pills? You're 98 years old and you don't take pills? She goes, that's why I'm 98 years old. It's a very, when you see it and when you can hear it, it's a very heartwarming skit. It's very, the comic timing of this 96-year-old lady is perfect. And it's very beautiful to see how someone had the openness and the willingness to discover a new talent, a new ability that they certainly didn't have before. Many people, of course, discover the talent of writing, the talent of drawing. As for writing, let me tell you something that might be of interest to you. Not all of us are Shakespeare, and not all of us can write in a way that is worthy of publishing. But as I've stressed to you before, no matter which way you write it, no matter which way you do it, what you have to tell is of tremendous value. The experience, the life lessons, how you took it, what it made you become, and why it made you become what you have become, is of tremendous value to many, many of us, certainly to your families, but way beyond the circle of your own family. There are many of us who are working very, very hard to collect whoever's memories, pictures, stories, who's willing to give it to us, because we feel that this is gold, that this is really, really gold. It's the gold of our culture, it's the gold of your generation, and it is particularly valuable because there aren't so many of you, and because of the magnitude of the historical events that you've survived and what it says about human resilience and human suffering. So it's very, very important. Now, I'll tell you also that when we look at the impact of writing, just writing, not good writing, not stylized writing, the mere fact that we tell people, listen, sit and write for 15 minutes about something that was very emotionally meaningful to you in your life. It can be a traumatic event or a traumatic event. It can be something else that was very emotionally impactful for you. Write about it for 15 to 20 minutes, 4 days in a row. When we do this, and we've done these studies on many, many groups of people, students, Vietnam vets, survivors of all kinds of other traumas, all kinds of people, what we see is that there is actually a variety of health benefits to it. So when you afterwards measure all kinds of objective measures of health, like liver functioning, respiratory, lung functioning, blood pressure, all kinds of things that are objective measures of better health, the people who wrote this, as opposed to people who sat and wrote for those 4 days, 15 minutes about neutral topics, the benefits are measurable in many, many, many populations. So, it's a simple thing. We can all do it. It doesn't matter how you write it. It doesn't matter who you show it to. The mere fact that you do it might have a benefit, and we have many explanations as to why it may have such a benefit, but suffice it to say that it is something that has all of these good reasons for you to do it, for your own health and for the fact that afterwards there is something left on paper that might be of great value to somebody else. And because it is important to know a little bit about how to do it properly, I asked Elizabeth to copy the instructions of how to do it and give each of you in case you would like to do it. Okay, so what we want is to be able to achieve what is these days spoken of as productive aging, active aging, vital aging, successful aging, optimal aging, all of these words which come to say we have changed our focus, like I said before. We have come to understand that while certain things go down with age, certain things can still be capitalized on. There are a lot of things that we can still do even when certain physical limitations impose themselves upon us. So I do want to share with you that studies that look at personality change over life actually show us in real hard data that there is evidence that people actually get wiser with age. You know, when we look at certain personality traits, and some of the big ones that we measure repeatedly in different studies, the big five are neuroticism, which is the tendency to respond negatively to things with depressed affect, to interpret things in a negative way, all of those things. That is one thing. The other one is conscientiousness. The other one is openness to new experiences. The other one is empathy, and there's another one, I can't think of it right now, of the big five. I can't believe that I'm forgetting this, but you see, age. Anyway, point is that as we look at these different traits, we absolutely see evidence for the fact that neuroticism goes down with age. Neuroticism goes down. Openness to the other.
What did it mean? What did the word autism mean?
Neuroticism. The tendency to respond to things with a negative mood, interpret it in a bad way, respond to it with difficult feelings. It goes down. Consistent with that, by the way, you wouldn't believe me, I guess, but you won't throw me out of the room, but it is true what I'm going to say to you. You know, the stereotype of growing old is that people will get depressed because it's depressing to be old. It's depressing to lose a lot of the capacities and competencies that you had, and people get depressed and there's nothing to be done about it. Well, it is not really proven by data that looked at various populations, not only in this country, in different countries. The population prevalence of depression at different ages in this country is about 15%. About 15% of the people are depressed at some point in their lifetime, and about 15% at different ages are depressed. But old people above 85 years old are much less. They have like 1.5 to 3% prevalence of depression. So, and it doesn't like start on your 85th birthday, right? I mean, what it means is that, you know, you don't get like to chuck your depression away when you turn 85. It means that as you grow older, the prevalence of depression goes down. There is a caveat, yes? There is a dipping point in life around age 50. I, for example, am at high risk because I'm around that age. Around age 50, there is the highest prevalence of depression. But as you go past 50 up, it goes down and goes much, much further down than for all of the younger age groups. So that's one thing that's actually surprising. Do you believe me?
Yes.
No.
I do.
I'm telling you, there is a lot of evidence to support it. So that's one thing. The other thing, like I said, yeah?
I believe you.
Exactly. The other thing, like I said, is neuroticism goes down. People have a tendency to not respond with such negative affect and mood to things, not take the worst interpretation of things. It's more that they mellow. In the public, in the general parlance, what people say, right, you mellow with old age. Well, they mellow with old age. They don't really seem to respond so negatively. And people have a much greater capacity to see more than one perspective on a matter at the same time and not think that the perspectives are contradictory. So we develop a capacity to see our own perspective in the context of other perspectives and not feel that they're so opposed that it's either or. In general, what I'm saying is there is empirical research evidence for the fact that we mellow out, that we gain an actually more positive attitude towards life, and that we gain maturity and wisdom. Because what is this about the different perspectives and all of that? It's really, in other words, it says we gain wisdom.
We are closing in on how much time.
Okay, so let me see what I would like to show you. Okay, so if we want to have time to discuss, I will just close with a few comments, and that is that what we also see from studies is that the most important things that have to do with people's reports of how well they do in older years is how much contact they have with other people. And that includes friends, that includes groups and involvement with things that are beyond the family, as well as, of course, the quality of the relationships and the frequency of the actual contact with family. But the role of friends, new activities and engagements is critical in how well we maintain our positive mood and capitalize on these natural processes that actually could help us have a productive and enjoyable old age. And by the way, these findings are true also on people who do have medical illnesses and who do have some physical limitations. It's not just those who are lucky enough to have the perfect DNA. Okay, let me show you this. Just one second. This is a video from a group that created a survivor theater piece in Washington Heights. And it's called Sosua because it's the story of a group of survivors that were accepted into the Dominican Republic. You know this very, very strange story?
Yes.
Right. So here it is, just to show you these two communities so different in Washington Heights coming together to celebrate the story of a survivor. And just a few minutes from there.
There's mostly Jewish people around here. We're the only Dominicans.
It's like we kind of didn't really like each other.
Concentrate. I want to feel your body's afraid. What? Well, much better.
A lot of people told me I'm not going to be anything more than you. You know how kids are.
They know it's something wrong.
And I prove them wrong. When I told them that I could be something.
I don't know why it doesn't play well. That's a real shame. That's a shame. Okay, well, I can only tell you that my friend, who was the director of this movie, allowed me to show it to you, and unfortunately I can't, but maybe we can arrange for that. There is the possibility of showing it to groups. It's an amazing example of what your legacy can actually do, not just in commemorating the Holocaust, but in actually making the world a better world and teaching new people, new young generations about different ways of relating to one another when there are conflicts between groups, when there are differences between groups, when there are traumas in their own past. Many of these kids come with their own traumatic circumstances, how to deal, how to work it out, even intractable conflicts, even severe traumas. This is a legacy of tremendous empowerment. It's a legacy of tremendous resilience. I wish that I could show you this, but if you want to see it, contact me, and I'll see if we can arrange for something like this. Finally, my last words are these. For age is opportunity no less than youth itself, though in another dress. And in the evening twilight fades away, the sky is filled with stars invisible by day. Thank you very much.
Thank you.
Questions?
You are a wonderful.
Wait, Rachel, we're going to take questions. 1 minute, please.
Thank you so much, Dr. Johnson.
Thank you.
What I wanted to add, I had an interesting experience a couple of weeks ago. I was somewhere where I heard a woman having an accent. I'm not sure where I met her. Turns out she is from Vienna, a survivor. And as we're talking, it turns out that she's quite older than myself.
You came with the train?
And I'm starting to talk to her about my experience, and she stops and she says, "You're so lucky. You were so little. You didn't suffer
Exactly.
the way we did." And I said, "That's what my mother said."
Exactly.
And I am telling you that children experience trauma as soon as they are born.
You know,
And that was, to me,
listen,
such an awakening again, bringing back my childhood, as my mother would say, you didn't suffer.
that is so true. And if we had time, I could show you a 2-minute video that I show my students about the interaction between infants and mothers, yes? And you see what we do, we call it the strange face experiment, okay? We take a mother and an infant and we ask them to play. And we have the camera full on the infant and full on the mother, you know, both two cameras at the same time. And then they play, they do their usual thing, the child is happy, the mother is playing, and then the mother, according to the cue from a researcher, has to go stone-faced, just like this, for a particular length of time, a minute or something like that. And you see the baby, it's unbelievable. I'll see if we have time, and whoever wants, I'll show it to you, because I have it here. First, the baby tries to engage the mother. What is this still face? The still face is an example of a mother who is either caught in her own thoughts for a moment, depressed, preoccupied, worried, not responsive to the child. Yes, it's a minimal example of a parent who is not available right now to the child to respond, which is of course what happens to people when they're afraid and worried and all of that. That first the child tries to engage the mother and goes, this is an infant, 8 months old. All kinds of vocalizations and with the face and everything. And then the child gradually gets alarmed, and you can see it on them. And finally you can see an alarm like, what, like calling the mother, like what's happening here? That's an infant responding to that. What about an infant whose parent is terrified? Terrified that the infant will make a sound, terrified from what's happening, running, fearing, cold. It's no doubt we can show it today, and we show it with very hard data.
The other thing that was even more striking to me, that person already had a child, had a regular home, and mother and father for, let's say, 40 years, which I didn't have.
Exactly.
And it's very interesting not to take that in, and somebody at such a mature age just throw it at me, oh, you didn't suffer.
Yeah.
At this time, I wouldn't expect this.
But this was
From
what
an
I said.
intelligent person just look at this and you didn't suffer, good for you.
But you know, this is you know, think about it, that the whole concept of post-traumatic disorder only came to be in 1980. Until then, all of these people did not think that trauma does these things, and certainly not to little children who are not aware of what's going on around them.
I'm oversensitive.
Brenda, I have to let somebody else talk.
Yes.
Many survivors have been interviewed or gave their testimony in the last 2 decades, and the Shoah Foundation has interviewed a great many. And if the interview is done correctly, survivors are now confronted with very tragic events. And the fact that they're coming after so many years, letting it out and being confronted with it, I wonder what effect this has on their on the post-traumatic stress. You may have answered that. It seems that coming to terms with the past seems to alleviate, be therapeutic.
Well, you know, I should say, it's an excellent question, and I should say actually as a warning that I forgot to mention, when you do the writing about, if you choose to write about a traumatic thing that happened to you or something that was very difficult for you, what we actually see is that in the few days following the 4 days of writing, there is an increase in distress. And afterwards, the long-term effect is health benefits. So this happens also often to people when they give their testimonies. You know, I participated in many of the interviews for the Yale Archive of video testimonies, and I also did a study on survivors in Israel. And this is why, for somebody like me, it's a little bit problematic, the idea that the interviewers are not trained psychotherapists, because you don't really ever know what's going to happen in the interview. You don't know. You can look at someone who is so successful and accomplished and well put together, and they can fall apart tremendously, or have, and then they will put themselves back together again, but they need help. And so it's an excellent question, and I think there is, first of all, for most people, there is a little bit of elevated distress after they give their testimony. I still think that for most people, the ability to create a narrative that has a beginning and a middle and an end, you know, the fact that we put our capacity to organize things and to think about it, which we have to do when we put it into words. Yes, when you put it into words, you have to say, so this is what happened, and then this happened, and because this happened, this happened. It's all processes of creating order, causality, and integrating things in a different way, which seems to be something that is very important to all of us as we grow older. Everybody, you know, Erik Erikson said in the 50s that the aim of every age has a goal, a developmental task that has to be achieved, and if it's not achieved, there is a price to pay. So a little child has to achieve autonomy, and afterwards the adolescent has to achieve individuation from their parents, and the young adult has to find intimacy with somebody else, and the middle-aged adult or the whatever has to have children or find some other outlet of generativity. And if we don't, if we fail at that task, we risk not feeling well and having all kinds of not good outcomes. And the developmental task of the later years is achieving a sense of integrity, a sense that we are who we were meant to be, that we're okay with the path that our life took us, including all the detours and the things that, you know, didn't go like we planned, that this made us who we are, and all of that kind of a process. And that is important for all of us as we reach old age. Even if we didn't live through a trauma, but my first marriage, it was such a terrible marriage and I wasted so much time, but it made me be who I am now, and it brought me to my second husband with whom I had so many wonderful years. You know, some kind of a way of integrating. Now, integrating severe trauma, such as the trauma of the Holocaust, is not easy. And there are many things that cannot be optimally achieved with such a trauma. Nonetheless, achieving some form of an integration like that, and especially when you are talking not to a tape, not to the wall, but to someone who really, really is there for you and really wants to hear it. And when you feel that it's going somewhere where it will be of value, and it will be valued as your own testimony, as a historical testimony for your family and beyond.
I'll tell you, I've been an interviewer for 3 years with the Shell Foundation, and to try to break through that shell, you don't know what to expect.
You don't.
And they tell us to follow up,
Right.
to make sure that there's no strong after effect. But I found most survivors had put up a wall, and they would just give you a chronology, like a travelogue, like
Right.
Auschwitz.
Right.
Yeah.
Right.
But to break through, it gets
I see
very
you were in
emotional, and some people
Washington,
hide
huh?
it
Exactly.
in
I
terms of
see you were in
humor.
Washington.
Yeah.
And one person didn't stop
I
telling
see you
jokes.
were in
Yeah.
Washington.
Yeah.
They have
But
the
when you break
symbol
through
on
it, it's traumatic.
Not only that, you know, even I know today people had to speak.
One more question.
One more question. Today people had to speak very briefly, but how many times do you hear from somebody, like you said, Gina said to me, at one point there was this and this and that, and for 6 weeks we subsisted, thank you, on snow. Only snow. And you go, and then she moves on. And I'm like, how do you subsist on snow? What do you feel? How do you deal? You don't get that unless it's very difficult. Yeah. There was another question. Yes, please.
I'm 85.
I'm sorry?
I'm 85 years
85.
old. I live I'm a resident in a old age, whatever. I cried myself to sleep for 2.5 years. Finally I said, I'm wasting time. The past is not going to come back to me. But whatever happens, someone snaps. I'm a nurse. I was a nurse. Just the snapping off the rubber gloves reminded me of something that happened.
Exactly.
I read an article in the newspaper that says if you have something to say it, get it off your chest. And he recommended another person who writes for the newspaper. She came. I don't have a computer. I talked. She typed it. I could tell you after the book was finished and edited, for the first time, my 85 years. I don't know how I'm going to. Can't talk about when I was a baby, but old enough to cry when it happened. And it was the first time I slept that whole night because I got it off my chest and somebody listened to it and somebody can read it. Somebody may understand. So for me, writing things down when you reach the end of whatever's bothering you is a really interesting story.
I'm very moved to hear it. I think that it's, you know, this woman who came and listened to you was blessed and got a great gift. And I'm very, very happy that it was possible.
But you want to know something else I want to ask? She was so thrilled doing this that she's going to go into business. She's had the card printed, that she's listening to people's stories, and she's going to make a book out of it.
Exactly. Exactly. Because you see, it is really true what I'm saying to you. You have so much to give. And you have the time now to give it. And there are a lot of us who are very appreciative and want to get it. Good for you.
I think we need to finish.
Okay.
Will you join us for lunch and stay a little bit? Or
Yes.
Yes?
Yes.
Okay.
Thank you.
Thank you very, very much.